that have been brought around in the adoption ecosystem, we are yet to see some more improvements. We need to still concern ourselves with the wait times, with the time the children are spending in the shelters, with the time that parents are spending waiting for these children. A lot is being done. I have a very distinguished panel for all of you today, and they will provide their own perspective on what is being done to improve the adoption ecosystem in the country, and also what more can be done. What is the role all of us as the citizens of the country can play in bringing more awareness on adoption and accelerating adoptions in the country? Just before I introduce the panelists, just a few things to remember. This is in a webinar mode, which means all of you are muted. The panelists will provide their opinion on the topic and respond to my questions as the moderator. You can use the Q&A section, the question and answer section in the Zoom window to submit your questions. I will not be able to unmute anyone, so please don't bother raising your hands. Just submit the question. Everybody else would be able to see your question also, and then the panelist will respond, or at the right time, at the end of the discussion, I will put your question across to the panel. Session is being recorded, and the recording will be shared on all social media channels of WAIC. In case of any internet interruptions, we plan backup, so please be patient, don't worry about it, and just log back in. Let me introduce you one of our distinguished panelists who's here with us today. Ms. Tripti Gurha is the CEO of CARA. She's the Joint Secretary in the Ministry of Women and Child Development. She's also the Director of NIPCCD, the National Institute of Public Cooperation and Child Development. It's the institute that leads research and training for domains related to women and child development. A very warm welcome to you, ma'am. Thank you so much for joining us for this session. We also have Parul Agarwal. Parul is a communications professional and also an adoptive mother. She founded the Adoption Action Group to help and support parents navigate the adoption process and try and create a voice for addressing related issues. She advocates for adoptions through CARA and works towards creating awareness in this direction. And we have our very own Meera. Meera is the CEO of WAIC, Where Are India's Children, an accomplished tech professional and with a deep commitment to the cause of child adoption and parenting. As the CEO of WAIC, she steered the organization to over 25 districts today, and Meera's strong leadership, her humble nature, and a domain understanding has really helped us drive the organization's growth. Really pleased to have you with us today, Meera. And I will be your moderator, Protima Sharma. I'm a director and co-founder at WAIC and also an adoptive parent and an adoption counselor. Let me just stop the share. Ma'am, before we get into all the questions, I just wanted to take 1 second and probably ask all of you, the wonderful women that I have, what motivates you to do what you're doing today? Tripti ma'am, to you, you have such vast experience of women and child development. What motivates you to lead CARA? And what gets you going every day to do this work?
Okay, so let me start with the beginning that I had with CARA, which started with an office order issued on 13th September 2021 when I had joined the ministry. Okay. And then I started looking into the grievances that were there. And looking into the grievances, it gave me an insight into how the system and processes at CARA work. And you know, everyone loves children. I also love children. That was very clear to me from my own childhood itself. So that commitment was already there. And while I was understanding the system, we got a huge opportunity in the sense of amendment to the JJ Act. And post-amendment, we were supposed to frame adoption regulations and model rules, etc. And that is the time we went to all the stakeholders, including the public at large, to get their opinions and all. And that is the time we started framing, you know, new policies based on the grievances that we had seen. And that is the time I came to realize that we can make a difference. And now when you see the child finding a family, there is no better satisfaction than that. And that keeps me going. That, you know, my passion for children has really kind of connected me with the work that I'm doing. So that is what keeps me going.
Oh, that's wonderful. Thank you so much for sharing that with us, ma'am. Meera, do you tell us what made you establish WAIC? a little bit of your own journey.
Sure, thanks, Protima. Thanks, ma'am. That's so inspiring to hear for us. Our adoption journey started with our son. He's almost 17 today. We adopted him when he was nearly 5.5 months through the old system where we could go to an agency and adopt him. That said, I think the inspiration to join WAIC, do something like this, I think was a chance conversation with him, where he was asking me questions about his adoption and how I felt as a parent. I could answer, very clearly and articulate to him about adoption, his journey, our journey with him. And I think that's where I thought somewhere that I can make some difference to the parents who are adopting today, right? This happened in about 2016. Where I had done my coaching, I was a certified coach. I was trying to find my niche area to coach and counsel. And somehow I felt drawn to the parenting topic, to adoption, and certified myself as an adoption counselor. Because I thought when we adopted, there was no literature about adoption. I mean, barely, I think internet didn't even talk about adoption. The word adoption would be about pets, right? So I think I felt I could contribute a lot more to the ecosystem. And when I became an adoption counselor, Pratima, met you and Smriti, and I think the digital campaign, which we started in 2018, I remember, I think I was the first volunteer to, join that. And today, I wouldn't say that I don't sometimes feel a little bit disappointed and down facing the challenges we have as WIC. But I think every morning when I get up, I also think of how many children we can actually make a difference in, how we can support, collaborate with the government and make a big difference in this ecosystem. And that's what keeps me going every day.
Great. Yes, Meera. Thank you so much, Meera. Yeah, thank you so much for sharing that. Parul, what about you? I think you're an adoptive mother yourself. And you started and you wanted to be the voice of the adoptive parents with the Adoption Action Group. What made you do that?
So, Protima, I think like you mentioned, my journey started in 2019. And I don't know if you remember, but you were literally the first person I spoke to about our willingness to adopt.
Really?
And, yeah, I'm sure you don't remember because we had a common friend and that is how. And, I'm so glad that in my first attempt, I landed with someone like you because you told me about the right resources, a few groups that existed. And, gradually I got a hang of things. The reason I'm sharing this anecdote today is that that's exactly how the entire adoption community in India survives. If there is any quick redressal, quick help, getting information in the short way of getting support, in terms of information, counseling, it comes not from a government agency, not from your own HSR agency, but from the peer support. And I will talk about the pros and cons of the system later in the discussion. But the reason I started Adoption Action Group was because in 2021, as I became part of these groups, I realized that increasing wait time was really bothering parents. They were very anxious. And there were a lot of questions, but they were practically, no to minimal answers. And despite being such an important stakeholder in the whole process and the whole gamut of things, they were not heard. They felt that they were not being heard. So, a group of us sat down and we thought that how can we solve this? Who is going to hear us out? And we realized that the Ministry of Women and Child Development is probably our go-to, and of course, to an extent, CARA, because that's where largely the things start, and then it comes to CARA, and then we also sort of made us aware about the whole ecosystem. And in the process, we realized that majority parents still don't know, which is again a very important part of knowing the process. So adoption and counseling is one, but you do need to know the system and process you're getting into. So I think that's precisely the reason I started Adoption Action Group. And like I think both Tripti ma'am and Meera have mentioned, this whole desire of making this transition smooth, bringing children into the families and making these families happy families is, I think, what drives all of us.
Great. Yes. Thank you so much, Parul. Thanks for sharing that, Parul. So I think we have the right people in the room. We are able to get different perspectives. So let's see how this goes. Ma'am, one of the first questions, and I think I'll just get the elephant out of the room or spot him. One of the first things, ma'am, that has been over the past years, Tripti ma'am, we've seen a lot of centralization of process, digitalization of process, amendments, constant trying to improve what can be done in terms of the adoption ecosystem. But still, ma'am, fact of the matter is that 30,000 wait, and they wait for 3 years almost. So what is CARA's vision to create more efficiency, maybe transparency? Can we really hope to see reduction in wait times in the coming months or years?
Pratima, I don't know how to reduce the wait time, because the gap between the waiting PAPs and the children that are there is huge. So from our end, one, we are also trying to do a lot of workshops with the CWCs who are supposed to declare the children legally free for adoption, so that whatever they can do in their on their bit, they can get more children in the adoption pool. And secondly, we are also trying to smoothen the processes that are involved, in terms of digitalization, in terms of, as I told, after adoption regulations, we made some new processes, we made some new rules through which, I think people must be aware about the 7-day portal. So wherein the child, after her routine referral cycle, if she doesn't find a family, then she comes to the 7-day pool where our RI, NRI, and OCI parents can reserve the child irrespective of their seniority. In fact, that portal has become so popular that a lot of children are getting reserved, through that portal. So from our end, after the massive discussions that we had with the stakeholders while we were framing the adoption regulations, we have only tried to smoothen the processes and be more interactive. We are more on social media now. We are interacting through Facebook groups and everything. But getting children into the adoption pool needs much more massive awareness. Then, in fact, Meera, while we were talking last time, she mentioned about, safe surrender at the level of villages. So that concept we are taking to Anganwadi workers, through our Poshan Bhi Padhai Bhi program. So, but then I think nothing is enough, because the number of waiting parents is so huge. One more thing, I don't know whether it's my place to say this or not. We give 3 referrals to the PAPs.
Yes.
So I have found, while I issue NOC to the children, so I see how many referrals the child got and everything. I somehow feel that giving 3 referrals and PAPs not taking any of the referrals, little bit speaks about the seriousness of some of the PAPs also. So that is a concern that I have noticed while I look at the referral cycle of the children while issuing NOC.
Right, right.
Yes, but I think such interaction that I'm having right now with you and with other stakeholders, members who are participating, maybe if something more can come, which we can do as policymakers, I will be too happy to go ahead to that.
Ma'am, actually, it's such a welcome change, the overall openness that you have to, receive suggestions and recommendations, and it's really good. And you did mention, yes, getting the children legally free to be added to the pool continues to be the big challenge. Maybe I'll have Meera respond to that. Meera, with the solutions that we have, with the use of technology, what is the process really to bringing these children, and how quickly do you think we can affect some of this? And will that have an eventual impact on the wait times also?
Yeah, thanks, Protima. Ma'am, thank you so much for that answer. So I think first, I just wanted to comment a little bit on the 3 referrals you had mentioned. I think at some level in our society, we are looking for a perfect child. So I think everybody is looking for that perfect, little one they want to bring home. And they don't realize that it is an individual. So I think we have a lot of work that, on that side of how do we change the mindset of our society towards children. We can maybe talk a little bit later on that. So Protima, what we are doing at WAIC, I think is the first step. I think today, and Tripti ma'am, you can correct me, I think we don't have an exact number of children that are there in India, pan-India CCIs. Because there is no way to track them. There is no verified data on these children. Because if we look at WRC's data collection today, right, 25 districts, we have collected 11,000 children. So even if we extrapolate that, we are looking at 735 districts, 36 districts in India. So that's a lot of children living in shelters. And we know not all of them are eligible, and we recognize that fact. But we also see that a lot of children who are eligible are getting left behind as well. And this is specifically the pool of 6 to 18-year-old children. And also we have seen while working, the SARS also needs streamlining. In the SARS also, there are children who are getting left behind, because a lot of children who come into CCIs are through the SARS itself. I'm not saying a great percentage, but a lot of children are coming through SARS where the SARS themselves have not processed, or the children have fallen through the cracks after a certain process has been done on them, right? So I think there is a massive need to first use technology at every level. I think even CCIs need to be educated to use technology. The DCPUs need to be given technology to get hold of how many children are there, first of all, in the system. And then, use of technology to evaluate, which we are doing currently, to use technology to evaluate recommended children, right? Because sometimes we do feel that given the fact that, let's say, a district child protection unit or CWC have other charters of work of child protection, they sometimes feel that adoption is the lowest priority because the child is in a shelter. So what? Right? How do we get that out? So let us say if we are giving them a subset of data, in a CCI, there are 100 children and we are saying, okay, can you evaluate 25 children for adoption? We have seen CWCs actually embracing that. They say, okay, this makes our job so easy, right? When I say easy, I mean at least less, right? They don't have to now evaluate 100 children for adoption. They're evaluating 25 children. I think that makes a lot of difference, and that can happen only through technology. Because if manually we are evaluating all these 100 children, it's going to take a long time. So we do need to embrace technology, and we have found success. I would specifically like to mention one district in Telangana which has embraced this, and wholeheartedly they look at this subset of data and are trying to evaluate children accordingly. And they have actually found solutions like the district inspection committees to review these children, so that when they're going for the inspection, they also review these children who we have recommended. So I think some innovative solutions like that, where it doesn't become an extra task, but it is part of their routine, work as well, will help. I think that is where technology comes into big use, Protima. So I know, I think CARA has been trying to digitalize and have asked us for recommendations, and hopefully we'll see this in the near future coming from the center. But at the same time, I think every stakeholder needs to have access to this technology, not just a DCP or a CWC. I think every stakeholder needs the access, including the SARS. And that's where I feel we can make a big difference.
Yeah. And I'll go to Parul then. So because technology is both at the back end, where you're processing the children, making sure that the children are getting identified regularly and getting LFA, getting added to the adoption pool. But technology is also at the front end, where we are serving the parents almost to say that, the due diligence, the HSRs, the entire process that you're following. So, Parul, in your opinion, right, the use of technology, CARA has definitely tried to simplify a whole lot and provide access and scale to this topic as well. So what are there still any challenges? What are the adoptive parents who've gone through the process thinking about it?
Yeah, so Pratima, I think, the adoption process is complex and cumbersome. And, we know that, yes, things are getting more technology driven so that they are more smooth, and parents across India can sort of do this, upload stuff, then parents can download it. But the reality is that it is still sort of in very nascent stages. So I think one of the key challenges that parents face in the process right now is that while things are changing, they are, I think, probably changing at a very slow pace. Because anyone who's getting a referral today and now, he or she is going to go through that process for once in life now. And if it does not, if it sort of hampers their experience, or if it does not make it smooth for them. And by smooth, I do not mean that it should be a cakewalk. By smooth, I mean that it is bearable and things at least work for them. So for example, things as basic as an adoption order has been issued and it is taking months and months to just upload it on the CARA portal. And then you literally have to figure out where to go in the website, how to do it. I mean, where you can access it. SARS don't know about it, DCPs don't know about it. So, I mean, information to information about what is happening and what is not happening, what is the right way to do it. So all of this, I think, creates a lot of chaos and mess, which is avoidable. Now, second thing that I would like to mention is that while this process is complex and cumbersome, I think that is a worry, but that's just 50% of the worry for parents. Interestingly, they are okay to go through this. They are okay to go through the paperwork and scrutiny and everything. What bothers them most is that the amount of scrutiny and the amount of caution is played on their end, which is very necessary, is unfortunately that the same accountability is not being applied to the other, parts of the processes. Now, something as basic as the MER that they receive, when the child is referred. That's one and only important document on the basis of which entire decision has to be taken. And if the MER is not detailed, it is not put up in the right manner, it is sometimes like a scanned copy of a photocopy, which you can barely read. And especially in the case of special needs kids, and if you go through IP list category, you find really, really, problematic MERs. So so that I think is a challenge. When parents say that simplify the process for us, they're not saying that you let go of the scrutiny and we don't want paperwork. What they're saying is that make it easy for us in terms of understanding and making things happen.
Right.
One of the other things that I would like to mention is, and it's again, like these are very basic things that probably can be done, but I'm not too sure why they cannot be. Like reference, publishing referral system on the website. Parents have literally been pleading for this for months and years. And right now the system is that you call up the CARA helpline and that is how you get that information. Now imagine CARA.
You mean the waiting periods and all that?
No. Yeah. Then? So what I mean is basically referral till which date in which state.
Right. The current the current referral,
and
which is
why that is important is because it is on the basis of that when I get closer to my referral, I'm able to assess how far I am in the process, how soon I can get, so that I can plan my life, my leaves, my interactions with my office staff about the leaves and stuff. And this is very important for the parents because 4 years of uncertainty, nothing at least closer to 1.5 months, you need to know things. So imagine 30,000 parents calling CARA applying for that one detail.
One piece of information, yes.
Yeah. And I'm really sorry, Tripti ma'am, for just sounding like a broken record, but the day that ticker runs on CARA website, you don't know how many parents are going to thank you because this is just simplify things for so many of us. And I think for example, for NRI and OCI parents, for them, AFAs are the point of contact.
Yes.
Now there is such lack of communication and coordination between AFAs and CARA that things and emails are pending for months and months. Imagine being in that position where you cannot reserve the child in any of the list yourself. You are dependent on the system. The system doesn't respond well. Where do you go? So, I think when it comes to parents, these are the things that just make it even more.
Yeah. I think, as you're saying, nobody is worried about the scrutiny because all of us understand that bringing a child home is an important responsibility and we have to be prepared for it. So we are absolutely fine. But I'll just take one of the points, one of the things that you said, Parul, about the MERs and the completeness and the relevance and the, currentness of the MERs also. And Meera, we found something similar, right, when we were going through some of the MERs, and I'm sure you had some points to make. Would you like to talk about that also a little bit as to, what can be done to make some of those MERs more relevant for the parents?
Yes, thanks, Parul, for that insight. So I think what we have seen is parents, when we spoke about the MERs, is they would like to have some categories, right? So because the special needs list today is very vast, and to find a manageable condition or to find the child they are being referred to is becoming difficult, or they want to reserve is becoming difficult for them. So they would like some categories of special needs. It could be physically challenged. And I think CARA did make some changes in the registration where they are asking when you register as for a special need child, they have made those provisions. Similar categories, I think, will help when the special needs list is there. Search criteria in the special needs as to, which child, which category, physically challenged, mentally challenged, both, etc. I think will help the MERs a lot more, the parents a lot more, so that they can sift through the list and maybe find the child who's calling to them. That is a major feedback, Protima, because they want the categories, they want it easy to be able to search. instead of going through hundreds of MERs, they would like a search criteria which makes it better for them to select a child which they think they can manage, treat, etc. So that was a major feedback. I will leave it at that for now. But that was a major feedback we had received.
So one of the points, Tripti ma'am, that Parul made, actually, even I see a lot of chatter in the, Facebook adoption groups around the referral dates, which is the currently going one. And so, ma'am, do you think this information, if it is possible for CARA to share that, that'll actually make, I think, it'll reduce the traffic to your helpline, I'm sure.
So yeah, I mean, we have been thinking of going ahead with that. Only problem remains with us is that at times there are changes. Are allowed to make certain changes, in which case seniorities get affected. And then that becomes very difficult for us to handle. But yes, point is very well taken. We will try to see how, maybe we can give a time period. If we don't have to be specific, if we can give a time period, at least you are prepared that, this is the time period wherein I may get my referral. That point is very well taken, but we have been trying to do that. Only thing is that when parents perhaps change their, their choice of a state, choice of child, something like that, then this seniority gets affected. But and then I would also like to react to the MER. So Meera and Parul, I would want you to look at the new format of MER, which we have come up after a lot of deliberations. So after going through that, if you still feel that we need to make a little bit more changes on the MER, we will be too happy to make that. That new form of MER we came up after Adoption Regulation 2020.
Okay. Great,
and then yes, categorization of special needs, Meera, that is on our radar. That is one of the technological interventions that we are planning to go ahead with. So that will happen, and not maybe in a couple of months time or something. That will definitely happen. Then I would also like to react on the number of children that we are not sure how many children are there in the CCIs. So and then Meera mentioned about use of technology. So I just want to bring to your notice that the Mission Vatsalya portal is now up and running. So it just got inaugurated. So we are trying to capture a lot of data through Mission Vatsalya. So I think maybe in some time, for 4 months, 5 months, 6 months, we will be capturing the data on real-time basis through that Mission Vatsalya portal. And then again, one more input on the age group of children between 6 to 18 years. So we have also started this new portal on foster care. So these are children in the age group of 6 to 18 are those children who are hard to place. So, and you will be happy to know that through that portal, at least we have gotten 2-3 children adopted by the foster families. So I think this is what we are doing from our end. But yes, your feedback is always very welcome, because, you face the problem from the other side. So it's very important for us to know what is your side of the story, so that we can improve our side of the story.
Thank you, ma'am. It's really heartening to know that so much, initiatives are being taken. And I think technology, I think all of us agree that it's an enabler and it solves a lot of things. But again, a big stakeholder are the people. And as adoptive parents, prospective adoptive parents, people in the adoption ecosystem, there's a bunch of stakeholders that we interact with, whether it is the district child protection officer, CWC members, the social workers, that we have to speak to, or we have to face panel interviews when we go and actually there for the child. And something needs to be done, ma'am, definitely, in terms of the overall sensitization, awareness, skill building of the entire the workforce which is present beyond the technology. And so before I go to Parul and Meera and ask them their opinions on what can be done, do you want to share anything that the ministry has thought of in terms of just improving the overall sensitization, the adoption mindset, etc.?
Yeah, I mean, see, from the CARA end, we have been trying to outreach as many stakeholders as possible. But right now, talking to all of you, it just struck me that the campaigns that CARA runs, if similar campaigns can be run by SARAs also. Only problem with SARAs is that most of them are understaffed. But whatever number of people they have, if we can have CARAs organize this outreach, awareness campaigns, that will help, because CARA is a very small body. We have some 19, 20 people working for CARA. So it is not possible for us, we keep doing online. In fact, if I share the numbers, they're quite encouraging. But I think as we all agree that there's a lot to be done in terms of awareness. So, what I will do in the month of November, which is the Adoption Awareness Month, we will try to make SARAs organize all these outreach activities, in addition to what CARA does on its own. And again, as I said, I'm very well open to whatever suggestions come from you all who've been working in the field, or from all the public who are listening. So, whatever can be done, we are very open, because we are equally committed as you are. So I just wanted to assure you on that.
Sure, ma'am. Okay. So, ma'am, definitely then let's get Meera's and Parul's view also. Meera, especially for older kids adoption, in terms of overall sensitization, I know we've been talking that if these kids move, at least the eligible ones move quickly to the adoption database, it will have an effect, overall impact on everything, their wait times, the parents' wait times, everything. But when it comes to people who are handling older children's adoption or processing them, where do you see gaps? And is this something that is worth looking at? And what can be done about that?
Thanks, ma'am, for that suggestion. And I think to involve SARA, I think is the best way to move forward. Thank you for that. So what we have seen, Protima, is when we work on the ground and we present a child's case, let's say the child is about 10 or 12, right? The first thing the CWC or the DCPU says is, ma'am, ye to adopt hi nahi honge. Why are we even working for them, right? Is a constant battle we have to fight, right? And moreover, to even get that child's data is difficult, because the CCIs themselves are averse to, I won't say averse, they're hesitant to actually look at this child for adoption, right? Though the law says it's very clear that 0 to 18 children have to be evaluated for adoption, there is a hesitancy on the part of the relevant stakeholders to do this. So that is a constant battle we are fighting. I think the sensitization, I know CARA has started a few sessions where they are trying to sensitize the DCPUs and CARA and CWC. And I'm part of one of these sessions where they are actually saying that please evaluate children who are about between 6 to 18 for adoption. And they are doing these sessions, which hopefully the DCPUs do that. But that said, I think there is again a massive awareness campaign needs to be done to say that these many children are there in CCIs who are between 6 to 18, they are adoptable. Please put them in the legal adoption pool at the earliest. I think that can be done only if it is done through, as ma'am said, maybe through SARA's outreach program, through the local stakeholders, like the ICPS can get more involved. Now it is called Mission Vatsalya, I think. They can get more involved in this and run programs. As I also mentioned earlier, I think we are becoming a society where we are saying, okay, shelter hai, basic needs are there. What else does a child need? Yeah. I think we need to look at the child's right to family very closely. And that is where I think our awareness programs need to begin. And maybe November Adoption Awareness Month is the way to start, where we also discuss this openly and say that it is easy to support a CCI giving money. But can you ask relevant questions as to why this child is in the CCI in the first place, right? Because today we have seen 60 to 65% of children have families who are living in CCIs. How do we reduce that number? How do we make them go to families? How do we have them live with families? I think needs to be a primary objective and sensitize that, yes, you have other child protection charter services to do, but non-institutional care also is one of the protection mechanisms for a child. And that has to come in the top 5 list of a DCPU or a CWC. I think that can only happen with massive training and sensitization. And WAIC is ready to partner in giving these trainings at the local level wherever we are working. We try to do that at every opportunity, but we are also we are saying we are open to doing these trainings at every level you want us to do, so that a lot more stakeholders are aware of this, that, this needs to be done. So,
Meera, can I react to that?
Yes,
you said that your So since I had this NIPSID, which is the Training Institute for our ministry's schemes also, and where we get all these stakeholders for training, from time to time. So then I would request you and Pratima to, whenever we are having CWC members as our trainees, as our participants, then we would like to have a small module on adoptions, although we have everything, but maybe, in a way that is more, understandable for them. And maybe you can talk to them also. You can have a session with them. So at least we start whenever we have the next CWC, group coming in, we would like to have you included in the training program.
Sure, ma'am. Sure,
Definitely,
ma'am.
ma'am.
Beginning
Definitely.
can be
Yeah.
mad.
Yes, ma'am. And I think I have a very similar question for Parul also. I think we've talked about how we need to sensitize the DCPUs, CWCs to look at older children, make sure they come. But again, as adoptive parents, you interact with many more. You interact with judges, lawyers, the trustees, the social workers, so many more. So if I were to just extend that thought, Parul, where are the gaps in sensitization? What has been the experience? And, where is it that we can do something about that?
So, I mean, I'll probably, talk from, the perspective of parents who are largely, unfortunately, adopting from 0 to 8 category. If that's the right way to put it, because that's the biggest pool, and that is where most parents face the process and they do it. And I think if I have to sort of categorize it in three, I would say the counseling gap at the social worker level is the biggest that we as parents face.
Right.
Both at the time of HSR and at the time of ACM, and it is very, very pressing right now per se, because because of the long waiting periods, things have changed dramatically. Parents who registered at sort of say mid-30s, they are now going to get it at late 30s or even early 40s. So the things that they thought and the way they planned will probably not work now. Parents are changing age groups. Suddenly from 0 to 2, now they want to shift to 6 to 8, they want to shift to 2 to 4. Are they ready for these older children who will come home and will have some background in the institutional care and how they will adapt? Who's doing this, bridging of gap for them? I think it also sort of matters a lot, because things as basic as changing your state preference to all India opens the pool. A parent from the south is now getting a children from north. Are they ready for it? And believe me, I cannot say that I speak to sort of 100% parents in that larger sample size, but there are lots and lots of parents who we speak to, and we realize that even at the ACM level, this counseling is not happening. Children are coming home, and this golden category where we say that there is least amount of friction, where there is most amount of smooth transition. If we are facing troubles here, I cannot imagine how it must be populating above.
Old children, yeah.
So I think counseling gap is one. The other that I feel directly affects parents in terms of sensitization is the sense of timeliness and urgency, and in addressing the queries and grievances. So if parents have a 48-hour window and they have a deadline in which they have to take a decision, the rest of the system also needs to be sort of geared up to be with them during that time. I don't know if that will happen through maybe having a dedicated person to answer these questions, or maybe like a 24/7 helpline, because referrals go out different times during the day. But when parents do not get their answers, that's like the most anxious time for them. There's so much panic, so much this thing, and you're just letting the referral go because you are not able to decide. And I think so resources are also sort of not available sometimes. I don't know if CARA has a central repository somewhere. We as groups try to create it. But again, we have limited access to parents, 300, 400, 500. If you're talking about 30,000, probably a central body is more capable of doing something like this. And I think the last probably will be sensitization of the crucial touch points for us parents, like passport offices and schools, and even the workplaces. And I'll tell you how. So passport in that sense is the most, it is sort of the most commonly accepted document, identity document. States do not have much to say there and change things there. So while we do understand that process cannot be standardized across the states in terms of adoption agency to agency, a lot can be done to make passport offices aware. Karnataka in that sense has been such a pain point for parents. I mean, we've seen so many cases. Tripti ma'am, I think, had to be involved in 2 to 3 such cases where parents and, the things were finally resolved. But what I'm trying to say is that, adoptions through CARA should be the first thing that should come to their mind when they reach, when, an adopted child comes to them through for passports. So if there is lack of awareness about CARA in these prime offices, it is very, very surprising. And same goes for schools. So in schools, you will have to do mass level campaigns. Companies, you will have to do mass level campaigns. But I think passport offices are easiest to fix. What are the documents needed? What are the documents that are not needed? What are the rights of the parents? Just need to build a repository and make it available.
Yeah. No, all
Can I just
great points. Yes, Meera, please go ahead.
I just wanted to react to something Parul said. I think what you mentioned about the counseling part of it, right? I think we do see an increasing need for that, right? And as an organization, because we work in specifically the older children pool, we see that need. But I think what we have seen is the need for parents, and I think early on I had mentioned they need a perfect child. Right? How do we essentially sensitize these parents that these children are coming from shelters, right? Their behavior, their initial stages of anybody is afraid of change. We are afraid of change, and as children, we are not giving them that space to adjust to a new environment, right? So I think, ma'am, it is more from an idea that just came to me while this discussion was going on. I think in the space of counseling, ma'am, because I know a lot of times we think that the HSR is the Bible of letting it determine that the parent is good to go. But I think it needs more scrutiny there, right? We barely see any HSRs being rejected actually. And that should be a marker that the HSRs are being done better, because at that level itself, if we see that a parent is not eligible or needs more counseling, I think that's where we need to catch those markers. And for that, I think a lot of private-public partnerships need to happen, because there are a lot of NGOs, groups that are working specifically on counseling parents for adoption today, right? There are so many of these organizations. I think we need to bring that partnership in the counseling, because we understand CARA alone can't do all this, right? So can we build that, bridge that gap by building these partnerships for counseling in all the states, so that it becomes, easy for the parent to reach out to, for counseling, as well as the government to say, okay, this NGO or this private, counselor can help you. That kind of partnership, I think, is the need of the hour. And again, this was something which I just thought, so I just put it out, but needs more, elaboration to it.
Yeah, I think counseling is one area. I think there's so much can be done. And so is, I think, the awareness part also that Parul mentioned. Passport offices, ma'am, definitely it's a great idea for me to look at. But
Pratima, can I?
Yeah, sure, please.
So I just wanted to react to what Parul said about, so I think Parul got the child in 2021, huh, Parul? Yeah. So I just want to tell you that, although whenever I say anything, I understand there's a lot to be done, but I also want to tell you what all has been done.
Sure, please.
So we have introduced this state-wise preference now. So the parents can now only opt for a set of states, depending upon where they come from, so that there is no, no problem of adjustment. The child is going in the same socio-cultural milieu. This we have done, and this people are really liking. Only thing is that this has not been done with the, I mean, we have done it now. So all the parents who are waiting before, so we could not change their seniority and all. So that we've done. And then passport, what we have done now, Parul, is that on carings, we have given a login ID password to passport officers also. So all the records, the adoption order and everything that are being uploaded on CARA website, the passport officer can also see. In fact, we had a lot of discussions with the MEA before we came up with this adoption regulations, because we got feedback like you are giving to us. So this window we have created, in fact, for birth certificate and everything, we have created window with the concerned stakeholder. And then, within 48 hours, you said that, there's a lot of questions that you need to ask. So although what we have provided for may not be enough, but we set up a help desk 8 to 8. 8 a.m. to 8 p.m., which is really taking all the queries that we have. All the time, these children are busy answering queries. But again, very open to what needs to be done next. And counseling, I have made a note of all the work that is being done in the private sector, if we can collaborate as their knowledge partner. And HSR needs, Meera, you said HSR needs better scrutiny. Maybe the format that we have for the HSR, maybe the kind of work that is being done with the HSR needs a lot to be done. But I want to tell you that at CARA level, scrutiny does happen, and there are a lot of applications which get rejected, but that is at the highest level, at central level. So we can do only as much.
Sure, yeah, ma'am. It was just an idea because we've seen that in Telangana. I've done trainings on HSR, for social workers, because I think the questions they ask or the way they're evaluating the parents is probably not the right way to actually do the HSR. So that was why I was mentioning. But yeah, if you're already looking at it, great. Thank you.
I think counseling at the level of, sorry.
No, go ahead, Pam.
Yeah. So I think counseling at the level of ACM, if it can be introduced, I don't know how soon we can do that, but because a lot of HSRs are now sort of, they have to be revalidated and you have to renew your HSR. And, parents who have waited for 3.5 years and who've undergone all of these changes that I was talking about are now going to go into the system. So if probably that can be taken up first, and then of course the new registrations and what Meera is mentioning, that probably will help a lot in improving things quickly, is what I mean. Like as the parents, children are being placed into the families. Because right now the system only is that you renew the HSR and you're done. There's not much that happens that stage. Whereas the fact is that you are literally going to the agency after 3 years, where you've made all of these changes, which the agency is not even aware about.
And even on the point of communication to schools and organizations, I just wanted to mention that we've also started getting a lot of requests as WAIC from corporates to come and do adoption awareness sessions for employees. In fact, we've done already in Pune, and next week we'll be doing a virtual session for thousands of employees across for an MNC, where there is interest to know more. And I think instead of us telling them this was good because there was a pull, so we were able to, do this. But I think if, we'll do whatever we can as WIC, but definitely I think workplaces is another place where it's worth thinking about whether some kind of awareness can be built in terms of the work which is happening in the adoption ecosystem.
Yeah, I'm sure. Yeah, I'm sure. Only thing is that, CARA tries to reach out to all its stakeholders, which is like huge in numbers.
Yes.
Anything over and above would be slightly overstretching ourselves.
Yes, of
but
course.
then again, as I said, we're very open to doing whatever is needed. And that is why, WAIC has become our knowledge partner. So we get to know what all is needed, what all can be done. So yes, since nowadays we can do all these consultations through online processes. So it should not be that huge a problem.
Oh, yeah, absolutely. In fact, we're getting a lot of requests from IT companies for virtual sessions across multiple locations for their employees. Okay. So we're looking at doing that for them also. Ma'am, if I move a little bit from, we've talked about the technology, we've talked about the people and what can be done in terms of sensitizing the people. Still, when it comes to the overall policy, and there are quite a few areas, one of the biggest ones that has really, at least bothered us for some time has been that we're still governed by 2 adoption laws, HAMA and JJ. So is there a plan for any legal uniformity? Do you think, right now is HAMA helping? What is the thought, going forward? How do we reconcile these?
I don't think, Pratima, it's my place to comment on that, because my ministry is guided by JJ Act, and the other act is with the Law Ministry. But there's some, some thought process going on.
Okay.
And I really don't know when and how it will integrate the 2 legislations and how it will happen. But, we have connected with HAMA in the sense that all those adoptive parents who want to relocate abroad, who have adopted under HAMA, The CARA is supposed to take care of their NOC.
I see.
So to that extent, Hama has crossed roads with CARA, and to that extent, we are getting the data as to how many people have it. But that's very small. That's minuscule. So, but I hope that someday it will happen. But right now, I don't see anything happening. I mean, it's not my place also, because
no, I understand. I completely understand. And I think that it has been, the discussion has been on for some time. And I think all of us talk about it also in the adoption groups. Meera, do you want to add, do you feel that illegal adoptions, so to say, what bearing the laws have on that? Can they be controlled in any way if we have some more uniformity in the frameworks?
Possibly, I think that is how I would put it, because I think unless it is done, we will not know how the impact. I think one thing we have seen, and a lot of DCPOs call me from rural districts, is somebody has a piece of paper, which is an affidavit, right, which says, I adopted this child from this person. Is this a valid adoption order, right? Is a constant question we get. And so it is a battle we are also fighting. Is this a correct affidavit order? And then, of course, I do refer them to lawyers, who work with the WCD, etc. But at the same time, I think the doubt that there is an adoption order, but is this valid because it doesn't have a CARA anywhere, it doesn't have anything anywhere. So is a constant, I think, question lot of DCPOs have and CWC members have. Do we treat this as an illegal adoption or not, right? So I think what happens is, maybe with the uniformity is like CARA has done with the intercountry adoption, right? If you have adopted through, or rather as somebody who wants to relocate and has adopted through Hama, they have integrated that with CARA. Maybe somewhere down the line, domestic adoptions can happen, the same way, because I think a lot of adoptions happen through Hama. I think private adoptions are there in India. So how do we bring that into the fold so that the checks and balances are also there, right? Today, I mean, unfortunately, I think some of the checks and balances are not there when private adoptions happen. How can we get that also into the fold of CARA? Maybe something will help parents also because I think when they know that it is perfectly legal, that, the private adoptions can happen through a centralized body, it could encourage people more to go through that path but with a lot of checks and balances, which maybe sometimes today is not present between private parties. I think that's all I can comment right now, because as ma'am said, I think we have some time to go before the uniformity comes. But maybe that is something, a best case scenario we can see. And also adoptions may rise, because today I think we don't know how many adoptions are happening. We think only 34,000 parents are waiting. But if private adoptions are also counted, I think India is a very pro-adoption country. So how do we get that data? I think it will help us to know that a lot of people are waiting. Maybe they are in lakhs. We don't know. So I think to help the adoption ecosystem, maybe that is the right way to move forward.
Yeah, great. Yeah, I think, thank you so much for that, Meera. I think there are a lot of questions flowing from the audience. So I'll just take a couple of those and probably see. One of the things on the policy again is, we've seen a lot of unsafe abandonment. I think we mentioned safe surrender and those things, but it's still rampant, ma'am. In fact, in some of the states, I think the numbers are really bad. So anything centrally in terms of policies or initiatives, apart from training, ma'am, any other central initiatives which we've thought of on unsafe abandonment or safe surrender of children?
See, we can only run campaigns, which we are doing in a large number as far as unsafe surrender is concerned. We're doing a lot of it. But I don't know how else to address this problem, but by way of awareness campaigns. So, all the panelists are there, if, somebody can suggest something else.
More can be done. Yes, Parul, go for it.
Yeah,
Okay.
Pratima, I just wanted to, I mean, I don't know how valid and how doable this will be, but being a journalist, something that comes to my mind is that, that the way it happened for suicide deaths in India.
Hmm.
So earlier, if you see the media reports, they would just sort of sensationalize it to the core possible. And of course, it was just like a crime report for them. And gradually that awareness came, and where also, after the initiatives of the government, it was put mandatory, led by the media, but then yes, there was a push by the government that every report that you put out about death by suicide, you have to carry a warning, you have to sort of give them resources, and you have to, even if it is a 100-word this thing. So I think apart from the campaigns that are being run, sensitization through media is a very, very robust and sort of high success rate factor that can be implemented, because the moment, because all of these, I mean, if you pick up local newspapers, that is where these reports get published.
That is published.
Very
yes.
scanty information, almost nothing, no follow-ups, but they do carry it. So if we want to sensitize people at that level, probably making these newspapers carry information about what other options are available, how safe surrender works, what it is a way forward. I mean, that is what comes to my mind.
Yeah.
Meera, you want to talk about
Parul.
the
Yes.
petition? Yes, go
Yes,
ahead.
thanks, Parul. I think in 2021, we ran a petition for about 4 months, which actually said that it is by the name of safe surrender, which we wanted the safe surrender information to be put on every abandonment or infanticide case, so
News
that
item.
it just doesn't become a news item and nothing else, right? Even yesterday, I read a news item. They had 4 lines. A child was abandoned by the bushes and was taken to the hospital. That is it. So what happened to the child? What could have been done to avoid this was not described. So I think it probably is at the level of, I don't know, the Information and Broadcasting Ministry, where they could actually just write 2 lines that this is an option under JJ Act, and please find the nearest adoption agency in this location, etc., or call Childline. I think the easiest is to call Childline, right? I think is something which is very, very necessary at this time to for especially prevention of unsafe abandonment.
No, I think in the case
we can be more aggressive on this, yeah.
Yes. No, in case of deaths by suicide, it primarily happened only after the mental care health came into mental health.
Mainstream.
The act came into being. It was implemented very, very rigorously, because then media houses had no choice. Right now it is, if you want to do it, I mean, even then they don't do it.
Yes.
But right now it's more like, if I want to do it, I'll do. But then it became like a mandatory call. You can be called up, the editor can be called up for that. So that's the thing.
Ma'am, there are plenty of questions. I don't know if we'll be able to answer all of this, but there's one very kind person who's offered that if you are only 20, do you need more manpower and can we help you? I think you can let us know what help you need, because of course there are more than billions.
Nice of this member attending. Yeah, I mean, it's a small organizations anyways, but is it possible for me to respond to question and answer on
Please.
a later maybe?
Yes, ma'am, I will compile all these questions and provide to you, and we can put it out on social media channels, the answers as well. But there's one question which has come again and again. Do you just want to take a minute and talk about the foster care? Because quite a few people are asking what is being done about the foster care from the ministry. Maybe that'll help all of us too.
Yeah. So there's a lot that we are doing on foster care. In fact, we are very excited to do what we are doing. In fact, the rule before the new adoption regulations was such that the hard to place children who were not getting adopted and who were legally free, they could be given in foster care. And if the child and the family, they adjust well with each other, after 5 years of such good adjustment, the child could be adopted by the foster family. So now what we have done, because we thought that the post-adoption follow-up is for 2 years. So we realized within 2 years, the child would have adjusted well with the family and vice versa. So we have reduced this time to 2 years now. So all those children, I think what the data that we have, I think we have around 500 plus children who are staying with the foster families. Already CWC have allowed them to stay with the foster families. So we already started their adoption. All those children who have stayed 2 years with the foster family, we've started their adoptions. And then we are also, making provisions on the portal, wherein the foster parents will be able to register themselves on the portal. And then from the immediate placement portal, they can look for a child and decide they want to foster this particular child. And the system will facilitate how we are facilitating the entire adoption process. So this we are doing. And I think in one of the regional symposium, we met one such foster daughter who was with her foster dad, and they were very happy. They had adjusted, and the father was very proud of the foster daughter. So I think this is what we are doing about the older children who are with us and who are legally free for adoption. And I think there are two modules. So the one wherein the child is already with the foster family, their adoption process has already started through the portal. And the second module is coming up maybe within a week's time, wherein the foster families will be able to register on their portal and then find the child through the immediate placement portal. That will be facilitated in a week's time or 10 days. Yeah.
Okay, great, ma'am. This is also very good to know. There's just one more, I think it's a suggestion, suggestion. Anushri has written that I know we are trying to improve everybody's SARS, CCNA, but there are still SARS who do good work. There are people, they take good care of the children, they provide the right support to the parents. And is there a way to applaud them also and provide some kind of, recognition to some of these SARS so that more people are inspired? And, it just sets a good precedence for the others as well.
I understand what you're saying, but as government, what we can do is maybe share their best practices with the other SARs for them to follow them, to emulate. And, this is, most of the SARs are grantee institutions. So we are taking care of their financials. So in order to encourage them, maybe we can share their best practices with the rest of the SARs who are not doing as well.
Yeah, and ma'am, SARs are such an important partner for the adoptive parents. I mean, honestly, I can tell you for myself, it is because of the experience that I had with the SAR for my first adoption that I decided to adopt again, right? My second experience wasn't great. Had that happened the first time, probably I would not have found the courage. But the first experience was so good that I thought, this is something I can do again. They're very important partners for us in the entire journey.
Let me speak a little bit about the processes that we've tried to address at the level of SAR also. So what used to happen, Parul, that whenever people used to go for adoption committee meetings, the SAR would ask for unnecessary documents. Now what we have done two things. We have given a list of documents. Those are the only documents that the parents are supposed to take with them, and the adoption committee cannot ask for the 11th document. So 10 documents are sufficient. So this we've tried to, so that there are not unnecessary demands in terms of documents. And we've also streamlined the usage of adoption fee, so that the maximum amount is spent on the well-being of the child only. Earlier, the usage of adoption fee was not specified. So we have done that also in order to make sure that the adoption fee that is coming is for the children that are there in the childcare institutions. So these are the two small steps we've taken as far as SARs are concerned. But yes, we can also, if there are some best practices that are there, that have been compiled, we can take it to other SARs, and we can put it on our portal also. So or if there is any other that you want us to do, which can be done by the government.
Yeah, and I think one of the again, this question has come quite a couple of times. I'll take that, and probably I'll just ask for last reactions after that from the panelists. I know we talked a lot about awareness and campaign for the stakeholders who are involved, but as a society, how do we make adoptions, more mainstream and not just for a few people, not just an option for a few people who are, adopting for it now? So I know it requires probably a blitzkrieg of media campaigning or, TV, radio, whatever. But any thought on that as to how do we bring adoption mainstream? How do we normalize it for more and more people? Introduce it early on in the curriculum of children, maybe, so that it becomes a normal thing for them as they are growing up.
Yeah, I mean, it's a great idea. Only thing is that as of now, for as CEO CARA, my struggle is to get more and more children in the adoption pool.
Yes, of course.
So
That's the
because I
prime
don't
response.
have a dearth of parents who are looking for
I
child.
understand. I
So
understand.
my only concern is how to get more and more children in the adoption pool, and to reach out to all my stakeholders who are involved in the adoption process to make sure that the process is, obstruction free and, as friendly as possible. But yes, this is also one side. But right now, for me, the priority is to get more children in the adoption.
Ma'am, we completely appreciate the priority. I think wholeheartedly we appreciate your priority. Yes, it is so important to bring down the time children are also spending in the shelter unnecessarily and get them to families. And some of us are always there to work on campaigns, counseling, etc., etc. This is one piece of work that we definitely look at you for. I will probably just take some last reactions now. Parul, anything more you want to say? You've heard Tripti ma'am, you've heard Meera, you've seen some of the questions which are coming from the audience also. What is bothering them? Anything you would like to say before we close?
I think, I mean, one, I'll try to utilize time the best way possible.
Sure, no,
Two quick suggestions and one sort of overall thing. For Tripti ma'am, ma'am, parents may come across always as people, who try to complain and who have a lot of grievances. But believe me, they are the real brand ambassadors of CARA. Every parent who registers with CARA is coming to you with hope to build a family. They have taken the first step in that direction. So the more we invest in them and the more we make this process smooth for them, the better it is going to be for everyone. And like we just talked about what can be done to sort of reach out to the society at a large, these 30,000 parents are going to be the advocates of adoption, and they are going to mainstream and normalize it for the entire ecosystem. So it is very important that it is a happy thing to do for them. That's the first thing that I want to say. Two, I have a quick suggestion on this new thing that we've incorporated for the special needs category. So now we have a separate list which says new in special needs, which is fantastic. It's a great move. But also what is happening is, because the children come and they are sort of reserved very, very quickly, literally sometimes in 10 seconds, parents reserve the child first and then they have time to go through the NAR data. And because of which what happens is, a lot of these children are not adopted at the end because parents do not find the NARs that sort of they can support or the condition that they can support. So if we can introduce, and this suggestion came from a parent, if we can introduce a window where the profile is made live, you are not, you cannot reserve the child for say 8 hours or 10 hours, whatever time we feel according to different time zones. And only after parents have assessed the NAR and everything, they have had time to sort of go through it and make up their mind, you then get a chance to reserve them. The fastest finger first will still be there, they will still be reserved very quickly. But the only thing is that we are giving them some additional time to think through this. Because when you reserve a child, the child gets blocked for 30 days. And then if the SA is not doing the due diligence of unlocking the child quickly, it is just adding up to the time and hassle and everything. And parents, I mean, for special needs category, I think it is most important that parents, for children and the parents, that one, the NERs are very thorough, so that there is no, to and fro with the agency, please do this test and stuff. Everything is upfront, there, transparent. But at the same time, parents need to be aware that this is what you're getting into to, avoid the hassle. So yeah, I think this is one suggestion that came from a parent, and I think this is very, very valid. That we can make this smooth, because we give this chance in 48 hours to the referrals, but for special needs, it's literally exactly like the child comes in 10 seconds, 20. How much can you assess in 10 seconds or 30 seconds?
So let me react to Parul. Yes, so grievances raised by PAPs. Just believe me, the entire thought process in CARA is to take the grievances as their feedback for us to get a chance to improve. So in fact, when I started my opening note, I said that, I started looking into the grievances that were there, and that is what gave me insight into how the CARA processes and systems were working. So we are very open to any grievances that are there, because, as I said, our commitment is as deep as yours. So, and then secondly, yes, special needs, as I said, earlier, I told Meera that I want you to look at the MER format that we have now. And if you find there is any further improvement that is required, we are very happy to take that forward. And yes, you said about additional time as far as special needs children are concerned. So, I think let me go back to CARA and let me see what can be done on that.
Great. Thank you so much for that. Meera, any last thoughts before?
No, I would like to just thank Tripti ma'am. I know Pratima, you will go ahead and thank her. Thanks a lot, ma'am, for joining this session for us. And we actually hope that more and more children do come into the legal adoption pool, and more parents also look at adopting older children as well through foster care adoption or direct adoption, whichever the case may be. Because I think at the end of the day, all of us are working for a child's right to family, and that is paramount. So thank you so much, ma'am. And thanks, Parul, to you also.
Ma'am, anything, any last words from your sides before I close? And I will tell you that there are close to 40 questions we've got. I'll compile them and I'll make sure they're available. And maybe jointly we can answer them and then publish them out. Yeah?
I think we've discussed everything that we wanted to discuss. I only want to assure all of you, all the members that are attending, all of you who are there on the panel, that we're very open to all the suggestions that come, and whatever is implementable, whatever needs some time to implement, we're open to everything. Our team at CARA right now is I feel is quite committed. And so anything that comes from your end, from anybody else's end, we're very open. And yeah.
I think from all our side, thank you so much. It is very, very heartening to know the openness that you've shown and the way you've responded to some of the suggestions also. It's really, really heartening for all of us. I think all of us are committed to make the adoption more child-centric. We are very focused on how do we make it, I know we're taking parents' perspectives and all that in place, but finally parents are also there for the children. We are all talking here, spending our time only because we're all concerned about the children who are there. So thank you so much for taking time. Thank you so much for speaking to all of us. I will close here, and all of you, thank you, all the attendees. You can keep sending questions here. You can also send questions on team@waic.in. I will put that in the chat, any follow-up questions, and we'll make sure that we respond to all of you as soon as possible. Okay. Thank you very much. Thanks, everyone.
It was a pleasure. Thank you.
Thanks.
Thank you.
Yes, Parul, you can log out. I will just stop after I've made copies of all the questions, and I'll stop. Thank you so much, Parul. Thank you.